Good morning, everybody. It's such a privilege and an honor to be able to speak with you today. We have a remarkable opportunity, and I want to leave you with one thing. We are actively and intentionally connecting Jacksonville to the world, and we're connecting the world to Jacksonville. And we're doing it through innovation. I'm a cardiologist, by the way, and that's what I do sort of for my day job, and that's what I'll be doing when I finish speaking with you. But innovation for me is a personal story. This is a picture of my mother and I on a beach in Port Elizabeth, South Africa. Taken about 60 years ago. Fun fact, Port Elizabeth, that's now called Gqeberha, is the sister city of Jacksonville. Who would have thought that this little kid over there, holding his mom's hand, would one day be speaking to you in the sister city a world away? It's the Matrix. About 20 or so years after this photograph was taken, my mom died of a stroke. It was devastating. As a young cardiologist in training, it was frustrating because I would see patients who'd present with atrial fibrillation, this irregular heartbeat, but they weren't aware of the irregular palpitations, they hadn't had symptoms, and the first time they presented to the doctor was with a devastating consequence of a stroke, because the upper chambers of the heart don't beat in a coordinated way. Clots form in those upper chambers, break free, and then can go to the brain. That's what my mom had. She had atrial fibrillation. And when we detect this as a healthcare provider, we can institute a blood thinner to prevent this devastating consequence. But we need to know that you're in atrial fibrillation. So as a young cardiologist, I was in the shower thinking, how could I prevent this from happening in the future? And I came up with an idea. How about like an atrial fibrillation detector? A Band-Aid that you could put on your chest that would screen in the background, identify the arrhythmia, and then alert a healthcare provider so that you could seek medical attention. Sort of like a system check required for your car. Now, had I had that idea in South Africa, they would have patted me on the back and said, Charles, great idea, but we've got patients dying from rheumatic fever, tuberculosis, get back to work. But I was fortunate. I was fortunate to work in an institution that arguably is at the tippy top of healthcare in the world. And they said, you know, Charles, sounds like a crazy idea, but we'll support you. We'll provide you the kinds of connections and infrastructure to help you try and bring this idea so it can benefit people around the world. And 20 years later, with those resources, with those connections, because I'm certainly not an engineer, indeed, an idea, patented, licensed to a small startup called Preventus, was acquired by Boston Scientific 2 or 3 years ago for $1.2 billion. But what's more important is that it's actually screening for atrial fibrillation in people around the world, hopefully preventing the devastating consequences of stroke. I bring this up because I want to tell you what a jewel we have in having Mayo Clinic here in Jacksonville. Mayo Clinic as an enterprise is a busy organization. Across our campuses, we see 1.4 million new patients each year. But what people don't really recognize is that we are not just a good healthcare provider. Maybe not the best healthcare provider. We are shaping the way healthcare is going to be delivered in the future. We are making a commitment to not just providing the best care today, but ensuring that we're providing the best care for patients in the future. And we do that through an incredible investment in research and education. We are discovering the new cures, and we are training the new workforce. Workforce in healthcare that right today doesn't even exist yet. $1 billion each year, Mayo Clinic as an enterprise invests in research and education. And right here in our Florida campus, we are growing. I'm going to quickly go through a few key statistics. Number 1 hospital in Florida by US News and World Report. Number 1 cancer hospital. We see 164,000 new patients each year. Our economic impact to the state of Florida, $5 billion. And we happen to be in the number 1 fastest growing city in Florida. I thought Laura DeBello's comments today and presentation were just fantastic. They were inspiring. They gave me goosebumps. I'm glad to be here. We are growing. In the last 5 years, significant increase in the number of patients that we are seeing. We have an education workforce of nearly 10,000. And our research productivity is dramatic. Innovation is ingrained in Mayo Clinic's DNA. This is an image of Kendall and Hensch. They discovered cortisone in 1925 and were awarded the Nobel Prize in 1950. Yuri Nenin published some very interesting research in the Harvard Business Review in 2011. They looked at hundreds of organizations around the world. Mayo Clinic came up as the most innovative, and they tried to figure out why. Why not Google? Why not Apple? They found 3 key drivers. 1, scarcity, sort of a paradox. But it must be that Midwestern heritage that our founders had, that they don't just ply you with resources, you've got to really earn them. Number 2, connectedness. The first multidisciplinary healthcare system in the world. I can access a world expert in any aspect of healthcare by dialing just 4 numbers. And furthermore, I don't mind calling and asking for help. I don't feel threatened because I know that just simply by being invited to be a staff member at the Mayo Clinic, I'm an expert. I'm recognized as an expert. And so if I don't know a particular area within an area outside of my area of expertise, I'm not embarrassed to ask for help. Because I know that my dumb question is going to be received very favorably, because that person knows that they probably would have a dumb question about something I know more about than they do. What that does is that creates a fertile opportunity for sharing of knowledge. And the final key driver, the one that is sort of closest home to me, is diversity. Not just diversity in patients that we attract from all around the world, but in the staff that we attract to work at Mayo Clinic. Think about it. A little boy in Port Elizabeth, in Africa, landing up at Mayo Clinic. That's the kind of diversity of talent and thought that we bring to common problems that people all around the world experience, but come with a different lens. We challenge dogma. There may be a different way to do something. And so what does this investment in research and education yield? Over 300 startups since 1986, over $1 billion returned back to Mayo Clinic through licensing and royalty revenue, but more importantly, the millions of patients' lives that have been impacted by Mayo Clinic discoveries. Cologuard, that poop test, so that you don't have to have a colonoscopy for those of you who are just at that sort of age. That's Mayo technology. Every single MRI has Mayo technology embedded in it. But innovation is hard. Innovation is tough. Innovation is not straightforward. What can we do to help innovators? The innovation journey is not linear, it's epigenous. From an idea to scale and impact to benefit people all over the world, super complicated. At Mayo Clinic, here in Jacksonville, we were afforded an opportunity to understand what does it take to build an innovation infrastructure that supports innovators in a complex matrix organization. Because it turns out, someone like me, having been at Mayo for 30 years in June, can have an objectively crappy idea. My idea can be a crappy idea. But because of who I am and who I know, and because of the legacy relationships I have, my crappy idea can advance really quickly. Conversely, you can have a young colleague, she's just arrived. She's objectively got a fantastic, transformative idea. But because of the clinical practice and how busy is, she doesn't know how to access all our resources. We have a paradox of plenty. Her idea dies and withers on the vine. That is not a good approach to bringing the best ideas to benefit people as quickly as possible. So what have we done? We focused on three things. We call them three streams. First, people. Without people, no ideas. You need to attract, retain, and polish talent. So I've been able to do that successfully with our children. All three of them live in Neptune Beach. Now, my biggest concern is keeping them there. Got them from New York, got them from Miami, they're in Jacksonville. Attract, retain, and polish talent. Two, curate a world-class ecosystem of resources. Resources not just within Mayo Clinic, not just here in Florida, but across the enterprise and outside of Mayo Clinic. Identify where the gaps are, intentionally fill those gaps so that we have access to arguably the best resource for a particular idea, wherever it is on that innovation pathway. And then finally, what I want to ultimately leave you with today is you need to then connect the very best ideas from that talent to that specific resource in your ecosystem so that you can move that idea further along its pathway to commercialization. And that is the Innovation Exchange. It's called the Mayo Clinic Innovation Exchange. No need to applaud, but I am excited about it. This is something homegrown idea in Jacksonville. It started off as an idea. It quickly became an enterprise effort. We have over 4,000 of our Mayo staff involved. And in fact, now it's become a global asset. And what do? We're a concierge service for ideas. We are in service of the idea, agnostic to who has the idea or where the idea comes from. And all we aim to do is connect that innovator to a resource within our privileged ecosystem that we have available. It's a warm introduction. That's what it is. And we basically use the Mayo model of care. I'm a cardiologist. I see a patient with complex heart disease. I take a careful history. I find out what their symptoms are. I do an examination. I do special testing. I then determine a diagnosis and a management plan. We've adopted that same Mayo model of care to healthcare problems, to an innovator's dilemma. We listen carefully to their problem and then figure out what's the best approach to solving it and connecting them to the right resource. And so, here you see a paradox of plenty. Resources all over the place, both internal and external to Mayo Clinic. We then superimpose the journey that the innovator has to take, much like when you put your guidance system in your car. The destination here is bringing that idea to benefit people as quickly as possible. And then we connect those innovators, depending on where they fall on the innovation journey, into the specific resource within our ecosystem. I just want to conclude quickly. We have a global reach. Jacksonville is connected to the world. We have over 90 companies now that are members of the Innovation Exchange. The Canadian Trade Commission sends us 100 companies each year who want to gain a foothold in the American marketplace. We then select 10 of those to become members of the exchange and then offer that concierge service to help them with the resources that they need. But this is really what drives me. It should drive all of us. Innovation is a personal story. Innovation People are dying today that would not have died had the solution been approved by the FDA yesterday. There's a sense of urgency. Innovation impacts our patients, it impacts our families, and it impacts ourselves. I want to say thank you very much for the opportunity to share with you. Hopefully I've left with you a sense of excitement, that you're proud to be in Jacksonville, and that you're going to be, that you will just share this broadly. Thank you.